Hi, I'm your host, Anne. With me today is my co-host, Albert. Welcome to this presentation of Day Talk. Today we will discuss an interesting drug.
Thank you, Anne. We will be covering a variety of topics. We would like to thank the USACPAN Graduate School of Nurse Anesthesia for sponsoring this segment.
Our focus will be on the drug, Hydralazine.
Hydralazine, or Hydralazine, a direct-acting vasodilator that is used clinically. Hydralazine is used in the treatment of hypertension and heart failure. The molecular mechanism of this effect is not known.
It is postulated that it either causes the release of nitric oxide from endothelial cells or by directly donating nitric oxide.
One thing is clear, hydralazine causes direct relaxation of the smooth muscles of the arteries, but does not affect the venous smooth muscle.
One effect of this drug is to decrease the systemic blood pressure. You will also see a reflexive increase in your patient's heart rate, and an increase in the contractility of the heart due to the stimulation of the sympathetic nervous system.
Hydralazine also increases plasma renin activity and causes some fluid retention.
Let's look at a slide depicting normal relaxation of the smooth muscle.
Hydralazine is not used as a primary drug for treating hypertension because it elicits a reflex sympathetic stimulation of the heart, in other words, the baroreceptor reflex. The sympathetic stimulation may increase heart rate and cardiac output, and in patients with coronary artery disease, may cause angina or myocardial infarction.
Hydralazine may also increase plasma renin concentration, resulting in fluid retention. In order to prevent these undesirable side effects, hydralazine is usually prescribed in combination with a beta blocker and a diuretic.
Hydralazine is used to treat severe hypertension, but again, it is not a first-line therapy for essential hypertension. However, hydralazine is the first-line therapy for hypertension in pregnancy, with methyl-dopa.
Common side effects include diarrhea, compensatory tachycardia due to baroreceptor reflex, headache, loss of appetite, nausea or vomiting, depression, pounding heartbeat, vitamin B6 deficiency, and drug-induced lupus erythematosus.
There is some interesting preclinical research currently with this drug for patients with multiple sclerosis. Due to the ability of acrolein to damage myelin nerve sheaths, acrolein may be a factor in the development of multiple sclerosis. Hydralazine, a known scavenger of acrolein, was found to reduce myelin damage and significantly improve behavioral outcomes in a mouse model of multiple sclerosis.
Albert, I believe we covered several important topics tonight regarding the drug, hydralazine.
That's right, Anne. Tonight's episode touched on an important drug that you may need to use. As we sign off tonight, we would like to thank you, the audience, for participating in this program.
We hope you enjoyed this episode. Thank you, and good night.
Good night.